We saw a more than 20% increase in the number of kids who completed suicide.
The pandemic taking a real toll on young people. Tonight, a warning and a plan to help with what the U.S. Surgeon General calls a mental health crisis. Good evening, everyone. I'm Alex Savage, in for Frank.
And I'm Julie Hayner. A rare advisory from the U.S. Surgeon General about an emerging mental health crisis. The rates of teenagers dealing with mental health issues such as depression and suicide has been increasing since the start of the pandemic. KTVU's Andre Sr. joins us now. He's in the newsroom tonight with the details from this public health advisory issued today. Andre.
Well, Julie, COVID-19 is turning into a real problem for youth. It's not the virus itself that's causing the problems. That was just a tipping point, and it's triggered a domino effect. The cost of COVID-19 among the nation's youth coming into more focus now as the U.S. Attorney General Vivek Murthy issued a rare public health advisory warning of an emergency youth mental health crisis.
We have a real increase in the number of kids who are suffering from depression and anxiety and who have had suicide attempts.
California has not escaped the grasp of this troubling trend, where Noble says in 2020 there were 5 times as many children who died from suicide than died from COVID-19.
We saw a more than 20% increase in the number of kids who completed suicide.
That report cited that in the U.S., emergency room visits for suicide attempts rose 51% for adolescent girls in early 2021 as compared to the same period in 2019. Symptoms of depression and anxiety have doubled during the pandemic, with 25% of youth experiencing depressive symptoms and 20% experiencing anxiety symptoms. Dr. Loretta Whitson, executive director of the California Association of School Counselors, shared one example: a student who attended Spanish language class online and is nervous about having to speak it in class.
He had feelings that he wasn't going to be successful or that he's behind in his academics, and that seems to be a very universal anxiety.
Whitson says fixing the problem will not be easy, especially with more counseling staff needed in schools to help students dealing with anxiety, depression, and in extreme cases, thoughts of suicide.
I find that school counselors are very busy with dealing with, almost becoming, instead of a comprehensive program, but almost becoming an urgent care system for kids where they're going next, and they're just trying to sometimes put Band-Aids on a very big wound.
The Surgeon General has limited direct power, but it's hoped that his declaration will lead to more attention, such as funding at the federal and state level. He recommends individuals, families, community organizations, tech companies, and governments focus increased effort to combat this problem, because if not, it will likely get worse. Julie, back to you.
Andre, thank you. And if you or someone you know needs help, you can call the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. The number right now to call is on your screen. It is 1-800-273-TALK.